Hi, so today's case study is a 62-year-old Hispanic female who presents to the clinic with drainage and irritated eyes that are swollen and produce constant tearing with honey-colored discharge throughout the day. She says the irritation started a few weeks ago. She went into the urgent care the other day, maybe like 4 days ago, and they gave her ciprofloxacin eye drops with pills, and that did not help her. She says that there's no pain, but the irritation is bothersome to her and there is swelling around the eyes. So her past medical history, she denies cancer, diabetes, and cardiac issues, but she does have hypertension and she takes lisinopril 5 milligrams BID for that, and that seems to be controlling her blood pressure. She did get her flu shots last year and her pneumococcal and tetanus shot. Medications that she's currently on besides the lisinopril is the ciprofloxacin drops that she was given by the urgent care, and those are 250 milligrams PO/BID and the eye drops. So social history, she denies smoking e-cigarettes. She is retired Spanish teacher, lives with her children. No known history for her grandparents. Her mother was overweight with hypertension and hyperlipidemia. And her dad had a stroke at the age of 72 with hypertension and hyperlipidemia as well. So the review of systems, she reports overall feeling very healthy with minor stress in her life, but doesn't report any type of mental issues or thoughts of suicide or anxiety. Her head, she reports some minor occasional headaches, which is normal for her. And obviously her chief complaint is her eyes, which she reports that it's swollen, irritated, she gets crusts in the morning, and a lot of tearing. She denies any visual changes or double vision, and she had a normal eye exam 5 years ago. Ears, there's just normal minor cerumen seen in both, no difficulty breathing. Her throat, she denies any difficulty swallowing. Neck is aligned and symmetrical, no stiffness or swollen joints. Cardiovascular, she denies any type of chest pains or palpitation, and neuro, as mentioned before, she denies any type of depression or anxiety. Objective, her vital signs are very normal, 98.2, no temperature, 78 pulse, 19 respiration, BP was 132/87, oxygenation saturation is 99%, and her BMI is 25.1. Her hair and her head, the normal texture, no trauma seen or noted. The eyes, there is some slightly pink tinge in the sclera and also swelling underneath her eyes and on her eyelids. The fundoscopic exam was unremarkable. Excessive tearing was noted with some scant honey-colored discharge just at the corner of her eyes. Her nose, mouth, ears, unremarkable. Heart was regular rate rhythm, respiratory was clear lung sounds. Skin was appropriate for age except for the swelling on her eyes, and neuro was a no times 4 with appropriate mood and attention span. So my differential diagnosis would be lacrimal duct stenosis. I know that some people think it might be pink eye, but the reason why I ruled out bacterial conjunctivitis and viral conjunctivitis was because, number one, she had no relief or response from the antibiotic treatment that she got, and also there was no discharge as far as like pus is concerned. It wasn't a purulent kind of mucousy kind of discharge, and she has this excessive tearing throughout the day, which is very common in lacrimal duct stenosis. Even though that is more of a pediatric thing, it still can happen in older adults. So my treatment plan for her would be to refer her to the ophthalmologist for further workup. Treatment would be to advise her to take a clean, warm cotton ball and to massage it over the eye, starting from the corner, and wipe over to the end of the eye 3 times a day. And then go ahead, and I would just educate her to not touch the eye with her dirty hands, practice hand hygienes, and also use a clean napkin to wipe away excessive tears. Follow-up would be in 7 to 10 days, and hopefully she can get her referral by then. And during this time, report any changes to the ER if symptoms are worse. So thank you very much for listening to my presentation.